Right now, Sadie's about 4.5 years old.
Watch this.
Think he wants to go back?
Because Sadie has a rare disorder, every other month we go down to Children's so she can be screened for cancer. And what they do is miraculous. The men and women at Children's Medical Center, when a child is broken, they will do everything they can to put that child back together.
I truly enjoy getting to know each child one-on-one.
I believe in the mission of Children's, making life better for children.
As simple as it sounds, just means allowing them to have a normal life.
When I come to Children's, it's not coming to work, it's actually going to my second home.
Making life better for children. That's the mission of Children's Medical Center today and has been since our founding in 1913. It is our passion every day, caring for children like Sadie Gruber.
It's the philanthropy in our community that allows us to build a hospital with a reputation that attracts the best doctors in the country. They want to come and work in a place that is supported by the community.
For our state and region, we are the place to go for the best pediatric health care. Children's Medical Center is one of a handful of preeminent pediatric hospitals in the nation. We are leading the fight against childhood diseases, injuries, and trauma. We are seeking new knowledge to improve the lives of our children.
Children's is a teaching hospital. We train the majority of pediatricians and pediatric subspecialists in North Texas. And through our close association with UT Southwestern, we can seek breakthroughs in treatment and cures that can change the course of pediatric history.
We provide better care for children because of the research that's done here at Children's with UT Southwestern. And the evidence-based training that our nurses and allied healthcare professionals receive improves the care for children at every point in our system.
We spend more than $50 million a year for the health and safety of children throughout our community, whether or not their families have the ability to pay.
Many of these families resorted to the emergency department at Children's Medical Center for low acuity conditions such as runny noses, ear infections, or sore throats. Conditions that are really better taken care of in the pediatrician's office. And so Children's invested in a network of pediatric primary care offices, and today provides a medical home to thousands of underserved North Texas kids.
The pediatric population in North Texas is growing. Today, there are 2.2 million children in Dallas and the expanding suburbs. By 2019, that number is expected to grow to 2.6 million. To keep up with the demand, Children's is planning additional regional locations, like this one at Legacy. To continue to provide the breadth and depth of patient care and advocacy, Children's and UT Southwestern have attracted world-class pediatric subspecialists. This elite group allows us to build excellent programs that provide the best care for our patients.
The institution really was forward-thinking and looking at the demographic growth and realizing that unless we moved beyond our downtown location, we would quickly be left behind in our efforts to reach out to patients who have a choice of where they receive their care. And so it's really by reaching out and becoming aggressive for the patients who have a choice that we all get to continue the practice that we really came to Children's for in the first place.
You know, medicine here at Children's Medical Center is often like a team sport. We have a multidisciplinary, collaborative approach to many different types of disorders, particularly with our Center for Cancer and Blood Disorders, as well as our Heart Center. Those are two areas where it really takes a team approach to provide the best in patient care. Children's Medical Center was recently named as one of the top 10 pediatric hospitals in the country, and I think that's a true credit to what's been going on over the last several years, not only clinically, but with our affiliation with UT Southwestern and the research that we've been enabled to bring to our clinical work.
We're on a pretty low dose.
Clinical care that is delivered here at Children's Medical Center and the research that is being done at UT Southwestern and the ability to combine both of those efforts together will clearly put us at the top of the medical world.
But doing outstanding work requires outstanding support. Children's is private and nonprofit, so many of our most meaningful programs are funded 100% through private philanthropic support. We don't receive substantial federal, state, or local tax dollars. We rely on people like you.
Kelly and I began supporting Children's Medical Center about 9 years ago, long before our daughter Sadie was born. And our older children, thankfully, had never been seriously injured or sick and had never even walked through those doors. But we knew that supporting our Children's Medical Center was important. And then when Sadie came along, everything changed. For the first time, we really began to understand and feel how important it is for the people in our community to give and to support Children's Medical Center.
Children's Medical Center serves Sadie Gruber and thousands of other children because of our world-class people, their devotion to children, and because of people like you who generously give for the health of all our children, ensuring we are the one for today's children and generations to come. Making life better for children.